Safety and Violence in the Healthcare Setting by Sophia Wynne. So starting out, what is violence within the healthcare setting? Workplace violence is defined as violent acts, including physical assaults and threats of assault, directed towards a person on duty and may be conceptualized as a spectrum. There are actually 4 different types of workplace violence. The first type is criminal intent. In this type of violence, the perpetrator doesn't have a legitimate relationship to the business or its employees and commits a crime in combination with the assault. An example of this type of violence is a pharmacist is held at gunpoint while 2 men steal oxycodone from the pharmacy. The second type of violence is client-on-worker violence. This type of violence involves a customer-client relationship. In healthcare settings, it includes patients and their families and visitors. Here, the perpetrator has a relationship with a business, such as a hospital or a clinic, and becomes violent while receiving care. An example of this could be a distraught family member assaults a triage nurse in the emergency room because his spouse has been waiting a long time and is seen in pain. The third type of workplace violence is lateral or worker-on-worker violence. In this type, the perpetrator is a coworker. Frequently results from a power imbalance. For example, from a doctor or a nurse, or from a charge nurse to another nurse under his or her supervision. Lastly is a personal relationship. This can include an abusive boyfriend comes to the hospital and assaults his girlfriend, a physical therapist, or if she was unable to take his calls. In this instance, it's more personal and it doesn't really affect anyone related within the hospital, but they are implicated because of it. I also attached an image within this slide, and it reads "not just part of the job." So this shows a graph, and it says healthcare makes up just 9% of the overall U.S. workforce. However, it experiences nearly as many violent injuries as all of the other industries combined. So this is a major issue affecting healthcare today. Within this presentation, I will meet 3 of the student learning objectives identified in the syllabus. The first is to analyze. The student will analyze workplace violence and the impact it has on patient care outcomes and nurse job satisfaction. Next, to discuss. The student will discuss the role of a nurse leader on preventing work-related violence and maintaining nurse and patient safety. Lastly, to identify. The student will identify safety measures to implement to prevent work-related violence. The course outcomes I will achieve through this presentation are as follows. First, to apply knowledge of leadership, management, and collaboration principles to the practice of professional nursing. Secondly, to assess the structure, climate, and culture of selected healthcare organizations as they affect safety and quality of care, and to examine strategies for nurse leaders to ensure safety and quality of care. I will meet these course outcomes through discussing the role of a nurse leader within healthcare, as well as the role of nursing staff on protecting themselves and others from workplace violence. I will discuss the implications of workplace violence within an organization as they affect safety and patient care. Within this presentation, I have included images, videos, and information to fulfill the student learning and course outcomes. Nursing implications. So starting out with nursing leadership. The Joint Commission recognized leadership's responsibility for establishing a culture of safety, implementing effective practices and policies, and education and training to mitigate workplace violence. Secondly is quality and safety in healthcare. The Journal of Nursing Care Quality conducted a study to pilot a violence management training program consistent with OSHA recommendations and a general medical unit, which was selected based on both the increased cognitive impairment of patients often admitted to this unit and the demand from the unit staff for measures to protect them from the patient and the visitor violence that has occurred. The methodology included an independent pre- and post-test design to measure improvement in participant knowledge following an educational program that included a simulation training and de-escalation techniques. The Staff Observation Assessment Scale Revised or the SOAS-S, was selected for data collection on aggressive behaviors pre- and post-implementation of the Violence Management Program. This study resulted in a quality improvement project that met its overall goal of piloting a violence management training program for the healthcare staff on a general medical unit. Knowledge of de-escalation techniques to reduce violence risk increased. Lastly is interprofessional collaboration. Preventing workplace violence within healthcare must encompass many healthcare disciplines. All healthcare members within a team can be a victim of violence. Thus, it takes the collaboration of all members to combat this issue. When a nursing team collaborates at an elevated level, which is vital within nursing work groups, it creates a foundation that improves collaborative teamwork across all disciplines. There is an abundance of knowledge and skills within the nursing profession, and nurses should draw upon their colleagues to build capacity in their own practices and to elevate the nursing profession. To collaborate effectively, nurses need to feel safe and supported. Role of the nurse leader. Nurse leaders have a significant role in protecting their employees from workplace violence. The Joint Commission has identified 6 roles of a nurse leader to protect staff from workplace violence. The first role is to provide adequate staffing, resources, and tools to assess for and mitigate workplace violence. This includes innovative resources and tools, such as tracking mechanisms to flag a patient with a violent history in the electronic health record, and behavioral emergency response teams. These are similar to rapid response teams that already exist. Secondly is to create a robust reporting culture. Leaders must constantly emphasize to healthcare workers that it is imperative to report all violent events that lead to harm or could have led to harm. Third is to know the organization's risk for violence. The first step is acknowledging that workplace violence is occurring everywhere, not just in urban emergency departments or among certain segments of the population. Thoroughly assess and vet the organization to determine the extent of workplace violence or the potential of violence. The fourth role is to establish constant training and awareness. Leaders should provide training and assessment tools so staff can evaluate for the potential of violence. OSHA recommends that training to prevent workplace violence should occur at least annually, but high-risk settings may need more frequent training. Another role is to practice de-escalation. A proactive plan for addressing patients, visitors, or staff who show risk factors or warning signs for violence should include de-escalation techniques, which is the first-line response to potential violence and aggression in healthcare settings. Lastly, to work in teams. When there is a potential for violence, healthcare workers should never work alone. Healthcare leaders must work hand in hand with healthcare workers to prevent workplace violence, but it starts with leaders setting the priority for zero harm due to violence and providing the resources, training, and support to accomplish this goal. Within the last slide, I discussed the role of a nurse leader, which is very important, but also nurses themselves hold a very important role in preventing workplace violence as well. The American Association of Critical Care Nurses have identified a few key things nurses can do to help protect themselves and others against workplace violence. These include to participate in educational training on violence awareness and prevention, learn and maintain your knowledge of your hospital's safety policies, procedures, and crisis plans, to report it, speak up if you experience an incident or witness violence against someone else, to press charges if you are assaulted, to support coworkers who experience violence, and to seek solutions as a team. Within this slide, I included the link to a YouTube video that discusses training for healthcare members to prevent and de-escalate workplace violence. Nurse Organization Meeting. I attended the Mid-Michigan Health UPC meeting, which is a monthly meeting for the union members within the critical care unit. The meeting I attended was aimed to discuss a problem that happened within the unit and to come to a solution to prevent it from happening again. The incident involved a patient being discharged home with oxygen and sent home with a tank, but it never getting turned on. The patient was instructed to call CareLink, a company that comes to set up oxygen and equipment, but the patient nor the family did, even though they were instructed on this upon discharge and sent home with paperwork to do so. This resulted in the patient being off oxygen and desaturating to a very unsafe level. Fortunately, the patient was okay, and CareLink was able to come right away to fix the issue. Within the UPC meeting, there was the nurse manager, a nurse educator, a social worker, and a discharge planner, the nurse that was caring for the patient, and the other unit council members. During the meeting, the incident was discussed and measures to prevent it from happening again. The members produced the idea to attach educational leaflets to each oxygen tank to be taken upon discharge, as well as address the issue to all staff members. In addition, mandatory training was completed to ensure that all nurses and aides were competent in turning on and off oxygen tanks and ensuring that they were working properly. Within this meeting, I observed transformational leadership. The nurse leader led the discussion, then asked for input from each discipline present to produce a solution to the issue that would best meet the needs of all. Transformational leaders use a collaborative leadership style that leverages a shared vision, encouragement, and inspiration to facilitate change, which is what the nurse leader did. This was a successful and effective approach to solve the issue that occurred. In conclusion, preventing workplace violence within healthcare must encompass all members of the healthcare team to be successful and effective. Nurse leaders have a key role in workplace violence. Workplace violence is not part of the job. And most importantly, learn what your role is and how you can protect yourself and others against workplace violence.